glad they have one of these because I hate microphones. I always feel like I'm auditioning for like the next episode of American Idol or something. I cannot sing. The other thing is, this has to be torture that I'm going after Mary and Dr. here. I was listening to Mary talk about being anxious, and I do keynotes and I do workshops all the time, but I am a very anxious person. I'm very introverted. I prefer to keep to myself. So here I am though. So I'm with you, Mary. I'm very anxious. Just because, even though you train on the same conversation, the same topic, your audience is always different. You never know what you're gonna get. Thankfully, this topic is a little bit more neutral because most of my work is about health equity and inclusive practices. So, and we're mostly from the same community. The other piece of that is that I tend to move around a lot when I do presentations because I'm a very anxious presenter. And so if I trigger your vertigo, just say, hey, can you stop moving? My eyeball's now following you. Or if you are recording and you're doing, some social media stuff, just say, hey, stop moving. You're ruining my digital stuff here. So anyhow, again, my name is Sheng. I am a licensed clinical social worker and a perinatal mental health certified therapist. Those are just acronyms that I am required to put up there by state licensure. So it doesn't mean much, it just means I have a higher education in social work and I'm licensed to do certain things. It, in some ways, just is a governing body over what I can and can't do. A little bit about the organization I'm with is Us Two Behavioral Healthcare. We are in Appleton, Wisconsin here, and so my partner and I founded the organization back in 2019 after I have worked for small and large entities, and really found that no matter where you went, all of healthcare, right, whether it was mental health, whether it was human services, whether it was aging, it didn't really matter. I kept coming to the same conclusion in the sense that it was very white affirming. So for all of our helping professionals in here, in your higher education and in your role, whatever role it's been, did you find that a lot of practices and ideologies and evidence-based practices were very white affirming? Raise your hand. Okay. Awesome, thank you for sharing that. And so something that I try to focus on with us too, and our mission is really trying to not eliminate, right, white practices, but really taking into consideration this idea of healing and recognizing that when we think about trauma, a lot of times our traumas didn't even start with us. As Dr. Yang said, whatever is silent in the previous generation is what we inherit. And so when we think about trauma, a lot of times it didn't start with us, and so the idea of us too is really just thinking about white affirming practices, what's working, what's not, and how do we create more inclusive practices. But our topic today is about perinatal mental health, because as again Dr. Yang talked about, many of our traumas started before we got here. And although we don't have control over, right, what we inherited from our parents, whether it's good or bad, we have an accountability and an ownership to what we pass down to our children. Who here is a parent? Raise your hand. Most of us, it looks like. Who here is an auntie or an uncle? Okay. Lots of hands. So many of us have maybe small little people in our lives, right, or minors in our lives. So when I think about perinatal mental health, or when most people think about perinatal mental health, they think about the mother, right? What's going on in the mother's lives, and how does that impact the baby, right, or the well-being of the baby? But guess what? Every single one of you who raised your hand, both gender, however you identify, auntie, grandma, uncle, mom, dad, you have a critical role in perinatal mental health. We all have a role in perinatal mental health. I'm not going to read our learning objectives to us because this is typically a 4-hour workshop that I provide in a very quick, like 60 minutes. So I will try to do the best I can and then leave room for Q&A at the very end. comes to mind though when you think about babies, childbirth, and pregnancy? Just take a moment. Maybe it's your own journey, it's what you've heard. What comes to mind?
30-day chicken diet.
Girl, yes, I'm with you there. You know, when I had my second child, okay, it's a funny story. My second child was born early, right? So like we weren't expecting it. And so she had to stay in the NICU for a little bit, so then I got discharged and I came home. And I was so hungry, so I made a pizza and I ate it. While, you know, my in-laws live with me, right? And so my mom calls me later and she was like, "What about pizza?" I'm like, "No." I was like, "What?" She said, "Put pizza." I was like, well, clearly my mother-in-law snitched on me because my 4-year-old isn't going to tell my mom she don't want to eat better. So yes, 30-day chicken diet. It's a love-hate relationship, right? What else comes to mind? When you think about childbirth, babies, and pregnancy?
Physical transformation.
Physical transformation. Can you elaborate?
Yeah, I think you go through your body changing, and then also like from I guess weight loss, and I mean then you go through a lot of like hormonal stuff too.
Okay.
And so yeah, battling your identity, and then also then the change of your body changing all constantly, and then you able to accept what you looked before and what you look at.
Yeah. Physical changes. Anything else? What comes to mind? Go ahead.
People have different perspectives of what is considered a life and not a life yet.
Okay.
So their decision and their beliefs is based off of that.
Okay. So like what's considered life and not before, when does life start, right? Okay. Go ahead.
Postpartum depression.
Postpartum depression, absolutely. Who here, when you hear like, oh, so-and-so's having a baby, or they say like, hey, I'm having a baby. Who here subconsciously and keeps to themselves and says, good luck? I do. And that's the true realities, right? That in this workshop where we call it the silent suffering, right? Is that parenthood, pregnancy, motherhood, fatherhood is so beautiful. And it's one of the most incredible things that we get to experience, right? But also one of the hardest. And it's not always rainbows and butterflies, right? Before and after. And when we think about perinatal mental health then, we think, how and what is our responsibility, right? As a community, as an auntie, as an uncle, as a mom, as a dad, as a grandma, a grandpa, what is our responsibility to that unborn child? Because we all play a critical role in it. So when we think about perinatal mental health, just a couple of statistics here is that postpartum depression is the #1 complication in pregnant women. We also know that 15% of women experience postpartum depression, 10% experience depression during pregnancy, and for our mental health clinicians in here that may know a little bit about kind of like how we diagnose it, what's categorized into mental health disorder and what's not, is that there's only 2 disorders in the full DSM that has a perinatal specifier to it. That is going to be depression and bipolar disorder, where we call it a peripartum period, meaning that the mother developed these symptoms, right, or this disorder as a result of pregnancy or postpartum. 1%, and I didn't put it up here because you might think, well, 1% is not that big, but it's the 1% we always hear about. 1% of postpartum mothers experience postpartum psychosis. So you're thinking, well, it's 1%, why is it relevant? Well, again, because those are the cases we hear about, right? Other perinatal mental health facts that we should be aware of is that 60% of pregnant people experience anxiety. 8 to 20% experience postpartum anxiety. Postpartum anxiety versus pregnancy. 3 to 5% of new mothers develop OCD. As a new parent, do you remember like you bring home this newborn, you're like, is it pooping? You're like poking at it. Why didn't it wake up? Or like you like your child starts sleeping for longer stretches in the middle of the night, and you wake up and oh shit, is that thing still alive? That's sometimes like OCD thoughts. And sometimes, a lot of times, it is very normal to be concerned about this little baby, right? But at the same time, if those thoughts become intrusive in nature, that is starting to really impact the quality of life, right, for that mother or that baby or that caregiver, then we need to start thinking about OCD. 9% of women experience PTSD following childbirth. And that's to take into consideration the birth trauma that might happen, right? Because something that oftentimes we don't also talk about is that giving birth can be very traumatic. Some women face near-death experiences, or something might happen to that baby. 20% experience suicidal thoughts or act. And again, postpartum psychosis develops in about 1 or 2 out of every 1,000 deliveries. Postpartum psychosis, there's a lot of research still kind of going on around it, but something to consider with postpartum psychosis is that there has been literature and research to, I wouldn't say that there's definitely a statistical prevalence there, but there has been research and literature to suggest that women who do experience postpartum psychosis are more vulnerable to psychosis during menopause. And though most women who develop postpartum psychosis, right, can be treated, and then the psychosis can go away on its own with interventions and treatment, we know there's some literature and research that, again, people that are more vulnerable than to develop psychosis episodes again during their menopause. Why does that matter? Why do we care about menopause when we're talking about perinatal menopause here? Because it can follow people through the lifespan. It's not just about this glimpse of time in someone's life when they were in childbirth or baby. The other piece with postpartum psychosis is that we do also know that it is more relevant or prevalent in populations that have been exposed to war trauma and torture and crimes, genocides. A research study found that was conducted on offsprings to Holocaust survivors found that the offsprings to Holocaust survivors were actually at a higher rate of developing schizophrenia and psychotic disorders. So people who were not in the Holocaust, but their parents were in war and genocide, were at higher rates of developing schizophrenia and psychotic disorders. At a much younger age, they were more resistant to medication treatment. I started my career really fun working with the county system in what we call the community support program here in Wisconsin. I'm not sure if other states call it the same thing, but essentially you're serving the most mentally ill clients in the county. That means they have schizophrenia or psychotic disorders, and the only thing that keeps them in the community is support services, wraparound support. And it was really interesting as a young clinician. I was like 23 at the time, and I was like really making it in life, right? It was really interesting that a large volume of clients were Hmong, around my age. So they necessarily weren't in the war, but they were offsprings to war survivors. So we think about postpartum psychosis and really take it into consideration. What is the stress of the mother when she is pregnant? Or what are some of the wounds that live inside her that is passed down to the unborn children. Men also can experience postpartum mental health disorders too. 1 in 10 men develop postpartum depression, 18% of men develop postpartum anxiety, 1 to 2% of men develop PTSD as a result of birth trauma. Who here in this room has ever considered that men can develop PTSD in the labor and delivery room? 2 people, I see. Why do we think men can develop PTSD from labor and delivery rooms? PTSD and prolonged grief are the only 2 mental health disorders that require an external event to occur to actually be diagnosed. So for men to be diagnosed with PTSD as a result of birth trauma, we have to think, well, what happened to him? Well, the mom had experienced a near-death experience. Who was in the room? My wife almost died. My baby almost died. My wife hemorrhaged. They rushed her to the operating table. Could that be enough to develop PTSD? Criteria number 1 is you were exposed to a near-death experience or something that you witnessed it, right? But why are we not assessing for it? Why aren't we even asking for it? At us too, we have a huge program around perinatal mental health, and one of our emphasis is around fatherhood engagement. Because if we want good maternal mental health and we want healthy babies, we have to think about who else is in that role. So if you're a mental health clinician or you're doing work around public health, really taking into consideration, why are we only assessing for one caretaker? If that caretaker baby is healthy, how do we know the other one's not? Well, shit, what if they're both not healthy? Are we just assuming that because the person receiving services is not healthy, the other one is? How do we know what protective factors there are or risk factors? When we can't see fathers as a role, as a critical component to maternal and perinatal mental health, we don't see fathers as important. And when we don't see fathers as important, they don't see themselves as important. And when that happens, they can't see their children. And when children can't be seen by their fathers, they can't see themselves. When children, again, I'll say that again. When fathers don't see their children, children do not see themselves. In the state of Wisconsin in 2023, 35% approximately, and this is not just Hmong population because Wisconsin doesn't have aggregated data on just Hmong population here in Wisconsin, but about 30 to 35% of men die by suicide in the age range of 24 to 44. Why do we care that men are dying at this rate in that age group? That is a prime age group for men to be having children. So if about, let's just say 33%. 33% of men in Wisconsin are dying by suicide in this age group that is prime to having children. That has to leave us to ponder, did they die by suicide as a result of one of these things? Were there pre-existing conditions? And are these children without fathers? So I asked earlier, what are the what comes to mind, right, when you think about perinatal mental health and you think about maternal health, and we all share a little bit. The true experiences is that there is so much societal pressure. From the moment that parents or new parents learn or find out that they're pregnant or they're expecting a baby, right away there's this planning, right? Okay, how much time can I take off, right? When is the expected due date? Who's gonna do what? What roles are we gonna play, right? Where's the child gonna go? Who's watching the child? Who maybe has to stay at home? Maybe somebody has to pick up a job. But there's so much societal pressure, and there's so much fake information out there. Breastfeed, don't breastfeed, do this, don't do that. Co-sleep, don't co-sleep. I just tell people at this point, the hell with it, just do what works for you. I mean, nobody really knows at this point, right? And I mean, for a long time, it was like this cry it out method, which I thought that was always wild. But for a long time, it was like put the baby in a different room. Like, hey, that's kind of, I personally thought that was kind of cruel. Like, I'm kind of scared of the dark. I can't let babies in the room, so it's cold. But now it's this idea pushed towards co-sleeping, right? Because it reduces their rates and risk of SIDS. But there's a lot of societal pressure about who you should be as a parent. And one of my biggest pet peeves is the people who don't have kids try to tell me how to parent. Like, dude, I don't want to go home and yell at my kids either, but like, I love my kids to death. I really do. I swear to God, I do. But sometimes it's like living with a bunch of cluster B personalities. Like, you literally just verbally assaulted me and now you want a hug. Like, that's what having kids is like, okay? Like, you literally just threw a shoe at me and then said, I'm really hungry. Like, okay, I will feed you because I have to, but like, I think you should apologize to me. My kids are a little older now, so it's just like, easier to like have jokes with them about it and talk to them about what's appropriate and what's not. My 11-year-old, she's got a lot of jokes. She came home one day, she said, Mom, do you know how you know that your mom loves you and that she's a Christian? I was like, what for? She's like, they literally will yell at you the minute you walk in, and then 10 minutes later you're like, open the wall. Yes, Claire, you got jokes. That's very true. Your Asian mother will yell at you, but you will never starve. But there's a lot of societal pressures about how we raise our kids, right? And in a world, in a country that is so violent right now, and so hostile, and so divided. You can have your own values in your home, you can have your own culture in your home. But unless you're, fortunate enough or that you choose to stay home with your kids and homeschool, which I certainly don't want to have any desire to do, you're still sending them to a world that is maybe very different. So there's this pressure to be the perfect parent, right? There's this pressure that, men are the caretakers and they're gonna go out there and just make a bunch of money and women are supposed to be this feminine thing that, stays home and takes care of their kids, but let's just face it, most of us probably can't afford that. In this societal pressure is pressure from decades ago that does not work in the culture that we live in now. Because we know culture changes over time, right? Generations change and perspectives change. So we can't keep doing the same thing and expect the same results. But there's also an adjustment period. There's role changes. Who you marry is gonna change when that baby comes. And that baby, whether you like it or not, is gonna take all your time. But that requires communication, right? And there's this societal pressure that you just, that baby comes home and you just figure it out and life goes back to normal. But like, no, it doesn't. Like, you're doing this shift and I'm doing this shift and you're changing diapers while I'm pumping. And all parents, right, both parents, their roles change. But as your roles change, what do you think changes with the relationship? Fathers report feeling neglected when that baby comes home, and mothers report feeling having to do all of the work and not seeing the work. Even though both partners and both parents are contributing to the greater good of the family and that baby's well-being. Our mental health then starts to decline, right? Because as Dr. Yang talked about, our well-being and our mental health a lot of times depends on our relationship. And if your partner in your relationship is down spiraling, that's gonna impact no matter how. That plus now, you're sleeping for 2-hour increments at best. And if you have more kids, will go up too. And there's balance. All of a sudden you gotta go back to work. All of a sudden, you know, that copay or deductible rolls in the mail, and you're like, oh shit, I gotta pay that. There's balance. How do you juggle work and childcare and parenting and partnership and relationships in a 24-hour day? And yourself. Even just school nowadays, they're dropping off the kids to school. I don't know how parents do it. So the kid goes to school by 7:40, they leave, they're out by 2:50. But I work 8 to 5, so let's just make that make sense. Thankfully, my home sick days available, but for most parents and most people, they don't have that opportunity. So how do we balance everything? What are some risk factors? Well, parents in multiples, people who have twins, people who have triplets. That's going to be a risk factor. Individuals who are struggling or have diabetes 1 or 2, that is also going to be a risk factor in perinatal mental health. Right? We know that thyroid is a hormone that can really impact, right, the hormones that may be occurring, the shifting in hormones when there's a pregnant person. Social determinants of health, someone's access, right, to resources such as healthcare, education, economic stability, right? Where they live, where pollution is being dumped. Did you know that only about 30 to 40% of our life decisions impact our quality of life and how long we live based on social determinants of health? That means about 60 to 70% of our life, the quality of our life and how long we live, has nothing to do with our life choices. It's determined by policy. It's determined by power that is controlled by a smaller group of people. So what I mean is, eat that cake, forget that chicken diet, forget the treadmill. Doesn't have to do with this anyways. But social determinants of health, when we think about it, also includes racism and exposure to trauma. We know that when a mother is stressed out, cortisol levels are going to increase. When anybody is stressed out, right, cortisol levels are going to increase. And that is passed through then the placenta to the baby. Why do we think we have higher rates of children with mental health disorders now? ADHD, anxiety. I'm pretty sure it's not because all of these parents are beating their children. I'm pretty sure most parents are trying their best. But the population that are having children today are exposed to a lot of violence and a lot of trauma. Think about the first school shooting you heard about. And you're probably my age, I'm assuming, or maybe a lot of you are close to my age. Columbine, 9/11. So when parents are exposed to things like racism, when parents are exposed to things like stress because they don't have transportation or insurance coverage, when they're pregnant or a mother is expecting a baby, that is going to have a direct impact on that unborn child, just very naturally. And that's not to say that we can and we will never, right, be exposed to stress as a human being, because stress very much is a part of human life. It's about how do we mitigate things that are preventable. How do we mitigate things that is not necessary? But it can be so basic, such as access to health, access to childcare, education. Medical complications also can have a huge impact on maternal mental health. If an individual, again, as we think about birth trauma, right? We also think about complications that might be happening during the pregnancy is going to also impact maternal mental health. A history of mental health and substance use is going to probably exacerbate during pregnancy. Trauma, as we talked about, thyroid imbalance, NICU stays, babies having to stay in the NICU or have an extended stay can really impact parents' mental health, relationship issues, fertility challenges, and financial stress. All of these things, especially if compounded, are going to impact the maternal mental health or the pregnancy experience and the well-being of the unborn child or when that baby is born. But as I mentioned, it actually impacts everyone. When a mother is stressed out and is pregnant, and it impacts the mother's well-being or the child's. Not just the birthing person or that baby itself. It impacts relationships and family. More than 50% of divorces occur after children or after couples decide to have babies. That's not to say babies ruin lives and don't have children. That's okay. Don't, if you walk away with anything today, don't walk away with that. It's for us to really understand the challenges that families are facing, especially with young children. But it impacts everyone because in 2024, research shows that when there's poor maternal health, it costs actually billions of dollars to our economy. Higher usage of emergency room with lower rates of preventative care, higher rates of child welfare systems being involved, more parents choosing to be a stay-at-home parent because of economical reasons, right, for their finding family, but maybe that may not serve the community as well. So when we think about who it impacts then, we really have to take into consideration subgroups, same-sex relationships, and childbearing. Did you know that in the state of Wisconsin, in same-sex relationships, the other non-birthing person would have to request to be put on the birth certificate? What about transgender men? We can have a lot of political debates about this. It's not my political agenda, nor is it anybody else's. But what we do know is that there are transgender men who are having babies, and they are at higher risk of developing postpartum depression and perinatal mental health symptoms. That's the facts, right? Immigrants, so refugees and asylum seekers, they are at higher risk of developing perinatal mental health and mood disorders, as we talked about earlier, right? Individuals who are fleeing war and persecution and genocide are going to be at higher risk for developing postpartum psychosis. And many times it is a secondary to the PTSD. Anybody here work with refugees? Immigrants? Republicans? And their family dynamics, multi-generational homes. Many of us live in multi-generational homes. Now, we think about the perinatal period, or we think about the maternal health of the mother. We have to think about a big moment, right? A lot of us live in multi-generational homes. And so we do have to take into consideration when that baby comes home, right? Or the impact of, childbearing or having children in the home, and who else is in the home and who else is going to be impacted by that. So you have in-laws, you have, maybe your brother or your sister or somebody else living in the home. Many times in multi-generational homes, well, I should ask all of us this. What is the purpose of living in a multi-generational home? What do people do?
Support and help.
What was it?
Support. And
Support. Okay.
help.
What was it?
Income.
Income. Okay. Why else do we live in multi-generational homes?
Culture.
Okay. And when we do live in multi-generational homes, all right, most often we all have a role, right? Your role is to watch the kids. Your role is the case manager. Your role is to read the mail to your, the elderly. Your role is to work. We all have a role, right? So when you think about maternal health and that baby or those kids, the role of caretaking them, right, gets divided up by everybody who's also in that. Whereas, more traditional, maybe in your nuclear families, we call it, right, where it's just like the mom and dad and the kids, where the mom and the dad are the caretakers, right, or they're the primary roles, whereas multi-generational homes typically have, different caregivers and everyone plays a different role. Single parents as well. I mean, God bless you, single parents, like that's hard. Like again, I love my kids, I have 2 kids, there's 4 adults in the home, including my in-laws, and some days I'm like, dang, can't do this anymore, I need to go to Target. Man, you guys can sit in the car and wait or scroll through your phones. I think I'm speaking for most of us women here who I'll just go to Target and like scroll. Who here goes to Target? Because I have to move over here. You need to go downstairs by your grandma, man. I'm going to Target. Some of my kids are too big now, so if I tell them to go to Target, they're in the car first. But single parents. Our society is not created for families who live in multi-generational homes and single parents. Even though it's more common now to actually see multi-generational homes across all populations than it was maybe like 10 or 15 years ago, it's also very common to see single-parent households. Society is not designed that way. Think about your work policies. Can we just talk about work policies for a minute? Are our work policies really designed for families? What are they designed for? It's a safe space, say it.
Convenience.
The employer, yeah. What was that?
Revenue.
Revenue, okay. What else? Think about your HR policies. Working hours, PTO, time off.
Single individual.
Single individuals. Is it safe to assume that it's designed for men? What? By men, for men. I see all the men in here like cringy, like this is the moment to stay silent. This is the moment to stay silent. And I say that because I want us to think about maternal health and healthy families, right? Outside the context of just what's in the home. Because many times, we don't intend to traumatize, right, little teen or kids. But we live in a world that is so not just violent, but it's so pressured by cultural norms that isn't working. Because again, it was designed decades ago before you and I even got here, and we're still doing the same thing, and we're not getting the same outcomes. We're getting worse outcomes. So think about your own organizations and the organizations you work for, and what are those policies in place to protect parents? Think about if you're a child, if you have children, when they have half days. Who's picking up the kid? Who's staying with the kid? There's closures of daycare centers. HR policies are always interesting to me. As I talked about with my first full adult job, right? I remember reading the HR bereavement policy, and it said that I had like 3 days for like my mom or my dad, or like my brother or my sister or my aunt. Or no, it didn't include my aunt. I'm not wrong. Or my grandma, my grandpa. If one of them died, I had like 3 days for bereavement. Dang, my people are strong. Mom died, I only need 3 days. Horrible, So think about though, family dynamics, multi-generational homes. You need your parents to help babysit. And so because everyone has a role, does your HR policies support you bring a baby home? Your mom watches your kid, gotta help her with something, right? Everybody's got a role. Adoption. We see, as a country, we actually see more and more kinship on the rise, especially after the opiate and the meth epidemic, where grandparents and extended family members are adopting children who are children whose parents are struggling with addiction. So that's on the rise. We see that actually more common. And even though in our culture, the Hmong culture, we don't have a formal process of like kinship, right? Through the child welfare system or through the court system, we know that it's very common within our community that people do just leave their kids with their parents while they're taking care of themselves. And that's also very common in other cultures as well. There's not a legal process they go through, but there's a more like a cultural informal process that occurs. Then again, we talk about fathers, right? The role of fathers, the role of the father as a partner, and then single fathers. We've also seen a rise of single fathers. When we think about single parents, right? Automatically, you probably think about single moms, but there's also a rise of single fathers. Why are we seeing a rise of single fathers? Well, divorce rates are up, separation rates are up. So you don't have parents living together, and kid goes back and forth, right? You got the single mom and you got the single dad, they're just not together. Adolescent parents, we know that the rates of adolescent parents or teen parents has actually decreased, so that's a good thing. But then because of that, we do see an increase in parents of multiples. The older you are when you're having children, right, the higher risk you do have for having children of multiples. And so there's a decrease in teen parenting, increase in parents who are having multiple children, especially like twins. We know that with adolescent parents, right, there tends to be higher rates of neglect within the household, especially with the baby, and that's because of maturity. All of us, right, as human beings, we don't develop our frontal cortex, right? We don't really get mature until about 25 to 28, depending on who you are, and based on gender and all of these other factors. So when you have, a 16-year-old, a 14-year-old, even an 18-year-old having a baby, right, or bring a baby into the home, there are, unfortunately, going to be more risk, right? Or that baby or that child is going to be more vulnerable to neglect in the home. There's also higher rates of like teen or high school dropout and less rates of postgraduate or less rates of higher education for individuals who become teen parents. Common mental health disorders. I just want to take a moment and look at the first column here of what is mental health, what are mental health problems, and what are mental health disorders. Because I hear a lot of these words kind of used interchangeably, especially for like maybe like non-clinicians or even just like the general public, especially with social media nowadays. So for a moment, let's just talk about mental health. We all have mental health. It's part of being human, right? Anger is actually one of the very first emotions that we develop as babies, right? And fear. So we all have mental health. And it really is just about our emotional well-being. It could be good, it could be bad, it could be neutral. Neutral's not a feeling, just so that you guys know that. But when we think about mental health, it's something that we all innately have. We can develop mental health problems though, right? And mental health problems is our mental health and well-being is just starting to diminish a little bit. It could be due to a lot of things. It could be due to, bringing a baby home. It could be due to positive stress, such as starting a new job. It could be due to a lot of things. But when we think about mental health problems, we really have to think about what is the impact of those mental health problems. Is it creating isolation? Is it creating conflict within the family dynamics? Is it creating conflict at work? If it's not, and it's just a slight decrease in mental health or well-being, then we just monitor it, right? Because again, as human beings, we're all exposed to stress. We can't live a life stress-free. Once you figure that out, you let me know, and we can go live on an island together. But inevitably, as human beings, we're all going to face stressors. Where it becomes a mental illness and a disorder is when the mental health problems are starting to be pathological, is what we call it. So it is so significant that it's impacting and impairing the individual's quality of life, well-being, and things that they really need to get done, such as being a parent, such as going to work, such as their daily activities that they were able to function before. So mental health problems, and mental health disorders. Somebody has poor mental health, it does not mean that they have a mental health disorder. Somebody is sad for a couple of days, does not mean that they're mentally ill. So when we think about the maternal health, baby blues. Baby blues is actually very common in mothers. And when we think about baby blues, it typically occurs within 2 days of the baby being born to up about 2 weeks. That's what we call baby blues. If something is lasting longer, then we're going to want to assess, or perhaps that, right, a mental health disorder versus just like a very natural process to childbearing. Something contrary to what most baby belly would think, right, is that when a woman has a baby or when a baby is brought home, that there's immediate attachment between mom and baby. We know that that's not true at all. And a lot of times, moms don't feel attached to their baby right away. Is that wrong? It doesn't mean that they don't love them. It doesn't mean that they don't care about them. But it is very normal and common for moms to not feel attached to the baby right away. I worked with a woman, and she was had her second baby, and she was in my office. She's like, I feel so guilty, and I feel like a terrible mom because I have this great relationship with my 3-year-old, and I feel like I made a terrible accident and mistake by having my newborn because I don't feel attached to it. What are your initial thoughts? What would be your initial thoughts if you heard that? Oh shit. And I said to her, I said, well, that's okay because you know what? You've had 3 years to develop a relationship with your first one. The second one just got here. We're not even on the same playing field. And you know how your 3-year-old laughs, you know how they talk, you know how they give hugs, you know what they like, what they don't like. This newborn just got here. Now that you don't love it, right? But it doesn't mean that you're going to be attached to it right? Because it's a new relationship. And so you're learning it. And the baby is learning you. So that's okay. So if we move to depressive disorders, then something to recognize with depressive disorders is peripartum onset, as I talked about. That just means for folks who are in here that are mental health clinicians, there is a specifier in the DSM that you could put peripartum onset as a diagnosis or as a little specifier. It means that the symptoms, the depressive symptoms, occurred either during pregnancy or 4 weeks postpartum. With postpartum depression, it usually does peak at 3 months after labor. And so mom might seem like totally okay, and then 3 months and afterwards, you might start to see an influx, right, or differences in. And then there's bipolar disorder. There's bipolar 1 and 2. Again, there is that peripartum specifier. Did you know that for women who have bipolar disorder, 50% of it is diagnosed during the peripartum period? So this is what they tell me. I don't know how to believe it, to be honest with you. Just because I feel like during pregnancy and postpartum, there's just a lot of hormonal changes, right, that we really impact mood. But that's currently what the literature says, is that in women 50% of bipolar disorder is diagnosed during the kind of like peripartum period. Just kind of fascinating. As we think about two mood disorders though, bipolar and depressive symptoms or depressive disorders. And then we're moving then to like anxiety disorders, psychotic disorders. What do you think in women are things that we should be mindful of as we think about mental health disorders and age? Anything that we should consider? Mental health and age. Most major mental health disorders for women, right, also occur during their, I would say like peak, right, or primary years of childhood. So you think about schizophrenia. For men, average age is what we say like 18 to like mid-20s. For women, it's later, right? But also, that same age period is the time that many women have children. And so, two things can occur at the same time, and if we're not familiar or aware of these things, right, a lot of things can go misdiagnosed or dismissed or overlooked. So for women, a lot of major mental health disorders occur, right, onset occurs during prime years of also pregnancy. So those are things that we should take into consideration when we're working with this population. And even if you're saying, well, I don't really work with perinatal populations, so I don't think it's relevant to me. Well, it is, because what about medications that we prescribe to women or adolescent girls? Most medications can have an impact, right, on the reproductive system. I'm going to move us to substance use disorder. Polysubstance use, unfortunately, is very common in the perinatal population. In the state of Wisconsin alone, it is not uncommon to have pregnant mothers who actually are drinking alcohol during pregnancy. Is anybody really surprised by that? Like, we literally live in Wisconsin, like one of the drunkest states. In states where marijuana is legalized, or the use of THC in edibles, it is not uncommon for mothers to be using marijuana and edibles or THC during the pregnancy stage, and also smoking. Co-occurring disorders is really common, so that's going to be like, maybe like depression and substance use. It's not to shame anybody though, right? We wouldn't shame somebody if they were having challenges with diabetes or whatever, right? So just recognizing that we talk about substance use within perinatal populations and maternal health as a way to raise awareness around it, right? Versus to shame, because you and I are not going to accomplish anything when we shame people about their addiction or their use. The goal is to really support the mom, right, in safe withdrawals. The other piece too, when we think about substance use, is that babies cannot be born addicted to drugs, even if the mother's using them. They don't have the physiological brain paths to actually be addicted to drugs. They can be born exposed, they can have withdrawals, but it doesn't mean that they have an addiction. The only way that we diagnose addiction is through the DSM. So just keep those pieces in mind. So talked about already, I got a little bit ahead of myself. So we're on time.
11:08.
Okay, so I'm good on time, right?
Yeah.
Okay. As I talked about, I got a little ahead of myself, but with substance use, so 10% of pregnant people do report current alcohol use, 40% report current use of one or more other substances, 7% of women report using prescription opiate pain relievers during pregnancy, 1 in 20 pregnant women report using drugs while pregnant, 7% permission report using marijuana, and 1 in 10 alcohol while pregnant. In this state, or in this country, we have a huge problem with alcohol in general. There's a huge culture around it. There's even people who believe that it is okay, or providers, and to share that it is okay to drink wine during pregnancy. You do you, it's your body, your family. But when we think about perinatal populations, co-occurring disorders, and substance use, right? And that's really around this culture of substance use in our country, in our state, and even in our culture. Do we agree that alcohol use disorder is probably a problem in our community? Like, I'm literally going to baby showers with like trunks full of like. So the exposure, right, not just to the mom, right, but if you think about, right, dads have a critical role too, right, and even the dad or the other partner may have to carry the baby. There's a culture around alcohol use within our community, and that's going to impact, right, the mom, right, if mom or the person carrying the baby is also maybe struggling, right, or has challenges with alcohol use disorder, and dad's over here, you know, wasted drinking into Bud Light at a bleed, well, the access is there. How does that impact babies? How does that impact newborns? So we have neonatal abscesses syndrome, meaning that babies who are exposed to substances in utero or within the womb, that they can have withdrawals, but again, they are not actually being addicted. There's preterm births, baby born before 37 weeks. Interestingly, Asian people in Wisconsin, or Asian mothers, actually are at higher rates of having preterm births. Are you aware of that? Asian mothers, or Hmong mothers particularly, are also have lower rates of breastfeeding, or moving off at earlier rates compared to other race and ethnicities. Substance use impacts child birth defects, neurodevelopment disorders, fetal alcohol syndrome, and the ovary withdrawal syndrome. If you work with this population or you work in hospital care settings, something to be aware of and mindful of is that whether a mom or a parent is struggling with an addiction and the child is born addicted to, let's say, opiates or methamphetamines, it is actually more lethal for both mom and baby to remove the baby from the mom. Over and over and over again, statistics and research does show that it is safer to keep that baby with mom rather than separating the baby, even if we don't agree with mom's life choices. I serve on the, I have the privilege of serving on the Wisconsin's maternal mortality review team, and this just means every year or every month we meet and review cases of mother's death. Mother's death is from pregnancy all the way to 12 months postpartum. And the literature again shows over and over again that mom and baby are at higher risk of death when you remove the two from each other, and there's higher rates of death within maternal death when there's child protective services involved. So whether we agree with life choices or not, if our goal here is to keep life, right? Keep mom and baby together so we can in the hospital settings. Maternal mortality in the state of Wisconsin, and unfortunately I can only speak to the state of Wisconsin. In Wisconsin, many deaths, maternal deaths, are a result of mental health and or substance use disorders. So whether that is an accidental overdose, or suicide, or other ways of accident, and we're not really able to determine, such as like a car accident. 29% of deaths are due to cardiovascular conditions. 73% of deaths are related to, 73% of pregnancy-related deaths occur during postpartum. We do see that there is an increase in drug overdose deaths in mothers. Right? Again, that's pregnancy all the way to 12 months postpartum. I think we have folks visiting us from other states. I would encourage many of you to look into the maternal mortality rates within your own states and then compare that to as well infant mortality rates. And then compare that to your prison rates. When you don't have fathers involved, you're going to have poor functioning, low mental health rates of mothers and babies. So what do we do, right? We talk a lot about the problems. We talk a lot about different mental health disorders and diagnoses. What do you do? This is mostly clinical, but also know that mandatory items up here, you don't have to be a mental health clinician to actually administer these outcome tools. You could be law enforcement, you could work in child welfare, you could work in WIC, you could work anywhere. What we do know is that if you're working with perinatal populations, and this includes men and women, right? We call it Edinburgh postnatal depression, or the EPDS, and that's administered usually at different intervals. And many of you are probably looking at me because you don't work with this population, like, what in the world, Jesus Christ, is this woman talking about? You don't even have to do any of that. Just know that if you have access to what we call the PHQ-9 or the GAD-7s, if you're working with an individual who is within this population, right, so they just had a baby or they're pregnant, and they score high either on the PHQ-9 or the GAD-7s, just refer them to somebody that specializes in maternal health. That's all you need to know. It's a lot of information, it's a lot of training. So best case scenario is I'm working with this individual, these are their circumstances, they're scoring high, refer to a specialist. Optionals based on clinical presentation, again, we can go over it in detail. I don't think it's relevant for our conversation. Recommendation, PHQ-9, GAD-7, refer out. With the more, I think with the psychoeducation and awareness around maternal mental health now, within your own state or even your own area, there's probably more licensed perinatal clinicians that you maybe are aware of or even thought of. And, you can simply just do a Google search, and many times they will come up. Let's get through these. All right. I want to talk about inclusive birthing practices, especially for us as a Hmong population. Our practices for childbearing and birthing is very different than maybe what our parents are used to, right, or our ancestors. And we're very privileged to have access to, Western medicine now. We're very privileged if we have access to like healthcare insurance and all those pieces. But there's a lot of parts about our culture within the childbearing, right, or postpartum period is actually very rich, right? That maybe many of us forgot about or haven't given thought to. And that's this idea of community. In the data and the research and the presentation that Mary and her team did, right, what were the two top things that adolescents were asking for? What are the two protective factors that adolescents reported? So we think about inclusive practices within our own communities, right, within our own homes. I think for a long time we started shifting to adapt, right, to Western culture. And again, that's very normal. Cultures change, right? People shift and adapt to the community that they live in. But kind of bring us back to our own cultural roots of community and village. Because it does take a village to raise healthy children. And it does take a village to heal yourself, right? Especially if you're a woman during the postpartum period. It takes a village to support one another. And many times, we actually do want that village. But because we live in an independent, right, society, right, and maybe we live hours away, or our grandparents aren't close by, or our extended relatives aren't close by, and so we are very independent with our families. But that creates loneliness. How many of you are a parent and have experienced loneliness? I know. How many of you are a parent and experience loneliness within the first year of bringing that baby home? We had brought home my first kid, and she was colic, and my husband was traveling at the time. I don't know me. I'm like, I don't know what to do with this thing. Like, this kid literally, like, when we think about like the aging population and like sundowning, like that was this kid. As soon as the sun went down, she was crying. She was so colic. But we need that village, right? And when we don't have that community support, what do? It creates loneliness. And it creates internalization of shame. Like, I'm a terrible mom. My kid is crying. I don't know why. It creates guilt. And guess what? Loneliness is a silent killer. Chronic loneliness is equivalent to smoking 15 cigarettes a day. So if you're a parent and you're lonely, not because you're not busy, right? If you're a parent, you're not busy. You and I need to have a conversation. But if you're a parent and you're lonely, you are internally developing a weakened immune system or mental health, right? Effects that is equivalent to smoking 15 cigarettes a day. So what do? What do we do? What are some solutions? How do we bring our culture back to maternity, or to maternal health and paternal health? Can we ask? Who here would be comfortable asking for help? And who would you ask? Siblings? Friends? Who here would say yes if your mom, maybe your brother, your sister, your friend said, can you please just take my kid for an hour? Who would say yes? If they called and said, I just need an hour here. Like, I just need to shower. I just need to not look at them. Like, can you please? I'll drop the thing off. Can you just take my kid for an hour because I just need that time? Would you say no? I think most of us would say yes, right? Unless there were some other obligations that we've already, committed to. So we ask. The biggest difference between our way of life now and back then is that we don't live on the hilltops together. So we can't just walk next door. We can't hear the baby crying, like, oh, wow, it's old. We have to call, right? But that's also a beautiful thing. We have access to technology. But we forgot how to ask. Asking is the most basic human condition, right? Outside of empathy, right? Outside of wanting, right, social relationships. Because we've internalized it. Somehow, this baby, this child, parenting is a me problem. No, it's not a me problem. It's not just the parent's problem. It's all of our problems. We are all accountable to raising a healthy generation after us. We are all accountable to the health and well-being of the children who are in school, whether you have a bloodline connected or not. So in the beginning, I had asked, how many of us are parents? How many of us work with this population? How many of us are aunties and uncles or grandmas and grandpas? Well, we all are. If we want to heal, and we don't want our traumas to be passed on to our children, right? We have to take ownership, not just of my kids, but other people's kids. I appreciate everyone being here today. Again, my name is Sheng, and I am the Institute of Health here. I saw a sign that said 10 minutes, 6 minutes ago, and then I have a hand out, so I'm like, okay, I gotta keep going.
How do you navigate someone who doesn't forget to ask but is afraid to ask?
So typically when someone tells me that they're afraid to ask, they don't actually tell me they're afraid to ask. They come into my office really strong, like, oh, I don't need help, I can do this. I'm like, yeah, but you're at a baseline irritable, right? So clearly you need to ask. So it's more about working through, right, like how to ask, what do they need, right, and what's wrong with asking. Because everybody say you can ask, right, anybody can ask anything, but you can't expect a certain, you can't set expectations about how people respond. And feelings are just feelings, right? Whether that's shame, whether that's anger, whether that's happiness and joy, right? Feelings are just feelings, it's what you do with those feelings that can or can't get you in trouble. Back here.
So while I was sitting here and listening to your earlier parts, I'm reflecting back to my early motherhood days.
Yeah.
And I'm thinking, well, holy cow, did I experience those mental issues? So my question is, to those who does not know, like new mothers,
Yeah.
how do we become alert and self-regulate and say, hey, I think I'm not feeling well? Because a lot of the time I've been told it's gonna be stressful, it's gonna be X and Y, Z, and it's normal, it's part of the process. I'm told so many times of that term.
Mm-hmm.
But then reviewing what you're listing out, and I'm thinking, oh, maybe I could have reached out. I think I did need help.
Yeah.
And it was quite the self-battle, I would say. So
Yeah.
how can some of these resources be available or can reach especially new mothers to be?
Yeah. So I know there is an initiative right now. Are you from Wisconsin? No. Okay. Can I answer you?
I'm from Minneapolis.
Minneapolis. Okay. So I know actually, nationally, there's a huge push around really raising awareness to these challenges in both mothers and fathers. And so I say that because then your OB units, right, your hospital systems, your pediatric units, your WIC centers, they all are supposed to be administering what I call the Edinburgh or the PHQ-9s to new parents. So I know that's a huge push. The other piece, and I want to go back to your part about like, well, they say it's normal and whatever, right? And that stress comes with the territory of parenting. Yes, absolutely it does, right? Kids are stressful. I mean, hell, people are stressful, right? And adults are stressful. So yes, it's a very normal part of parenting. But when you're feeling stressed, when you're internalizing it, right, in your experience you said, right, like, what do you think is sad? Where did it go? It stayed in your body, right? Like, it went here, you probably felt it in your stomach, you were probably just disassociating. Like when mothers say, like, I'm so tired, even if the baby is sleeping, yes, that's very true, but part of a lot of moms is that they actually do disassociate through the stress of parenting, right, and motherhood and the journey of it. So yes, you survived it, and yes, most of you will, 99.9% of the population will, but the idea here is that when you were stressed, it didn't just sit there. It passed from you or stayed in you and went somewhere. And I'm willing to bet it probably went to your partner and to that child. And so that is how trauma passes through us. Not just through genetics, not just through changes in our chromosomes and DNAs, but it literally passes through us through silence and our behaviors, and it builds resentment and it builds anger. And that's when unhealthy families start to develop.
I have one more.
Yeah.
So then we talk about it's a community raising that child for the best help and love. So recently, my partner, we just went to a kid birthday party.
Yeah.
And that child father happened to pop a can of beer. So we felt awkward that we like wonder whose birthday party is it now? Right?
It's the dad's.
Right? And so then I feel obligated, but I'm asking for a tip, how to handle and address that kind of a situation, knowing that this is my niece or nephew's birthday party, but their dad pull out the case of beer.
Yeah.
We're uncomfortable, but we don't know how to address the issue.
Yeah. It goes back to that silence thing, right?
Yeah.
Can we just like agree in a room here and throw tomatoes at me if you want to, but can we just agree that there's probably certain events that alcohol doesn't belong at, like
Amen.
a 1-year-old's birthday party. Can we just agree? Like, okay, so like you don't have to feel shame for being the one that says no alcohol allowed in the text message or your Facebook invite, right? It's like, let's just agree that there's probably certain places that we just don't bring your blood light, dude. Like, if this is the only time that you and the folks there, are gonna see each other because it's been a couple of months or whatever, like, make a plan to go somewhere afterwards. I mean, how long do birthday parties really last? Right. Other questions? Oh, go ahead.
Very interesting with your findings there. I never knew that men suffer postpartum. I think when I first had my first son, I was watching football, right?
Yeah, okay.
Fantasy football, those who know.
Don't get me started on fantasy football there,
Yeah.
Boo.
So I had my son,
Yeah.
and obviously I was watching football and I was stressed out because I was losing. And I was losing that game, so that wasn't cool. But, it comes to a point where you think about us as fathers, as a first father, or a son comes out or a daughter comes out, we think about how can we protect them, men, how can we protect them, how can we do this? I think for moments I had dreams about me protecting my son, and no matter what cost battles and everything like that. How do we, I guess my question comes down to, how do we help, like for my son to understand that it's okay to ask for help? Because even though you're stressing out, don't keep it to yourself.
Yeah.
But open up.
Yeah.
Because I kept it to myself, I never told her ever until now. So, because I thought, oh yeah, I did suffer. I told myself how I suffer. I was never the same, I guess, from after. So, my question to you is like, how to men themselves and also to express, your sons, my sons.
Yeah.
It's okay to be not okay.
Yeah.
And to talk to me when you have it. So, or when you have the first child.
Yeah.
Or whatever. So how would you go about giving us tips?
Yeah, learning is such an interesting concept when you think about people, right? And people are learning even before the pre-verbal age, right? So what are some tips about how do you teach communication to children, right? The easiest way is through role modeling. Because sometimes, as parents, it's hard to be vulnerable, like, okay, I'm sorry, I shouldn't have said that to you, right? I mean, that's just an example, right? But if we ourselves maybe are still going through a state of self-discovery and learning some about how we communicate, the best way to do that is, especially for children, is through role modeling of, I'm really sorry, Johnny, right? Or whatever the child's name is, right? Or how they witness you talking to your partner or other people, right? And you see things like, I'm really sorry, or this is how I feel. When you did this, I experienced this, right? We live in a very traumatized society. And when I say we live in a very traumatized society, I say those events, those things, something happened, right? Those wounds live within us, right? But if we don't heal those wounds, we can't teach our kids how to heal wounds. So you first have to reflect and be able to model that through your relationships. And that's relationships, like it's not being said, relationship with yourself, relationship with your wife, relationship with your other children, and those who you care most about. Because if your kids can say, instead of see it says, yeah, sometimes mommy and daddy argue, but they love each other because I can see it, right? Your children are gonna want to then resolve conflict amongst themselves. So they can say, yes, me and my brothers can fight and argue, but we love ourselves, right? So conflict resolution, communication, love and empathy. Your kids will see that directly through you because remember, if you don't see your kids, they will see you. They don't see themselves. And it goes both ways. It's not linear, right?
Thank you.
I have a question about how you would go about, we talked a little bit about how first onset psychosis is more likely among women who are in the very child age. Given some cases in the past and currently when women experience an experience of psychosis in that period of maybe childbearing age, and there's also that aspect of, spirituality, animism, shamanism. How do you balance as a provider in getting them, because essentially when you have postpartum psychosis, that's a medical emergency.
Yes.
So how do you balance that level of, okay, at what point do we get the help that is needed?
Yeah, I think that the biggest difference between psychosis and shaman, right, is the reality based. A shaman is still reality based. A psychotic person isn't. A psychotic person, depending on their level of psychosis, right, and hallucinations and delusions, they might be they might be in another world, right? They might not even be oriented to day and time, right? Whereas typically a shaman or somebody who believes, right, in our culture, right, that we can talk to our ancestors, that person is still very reality based. You ask them what day and time it is, they can tell you. So that's usually how I differentiate between the two, but that's usually how I explain it to my own clients, is like, yes, you can, right? You can believe that you have your shaman and that you have this privilege and opportunity, right, to talk to your ancestor, but there's still a safety component to it, because the longer that we prolong treatment for anybody who is psychotic, right, the more gray matter damage you're actually creating, and the more separation you're creating from mom and baby as well, and that creates risk. And so it's always this level of reality based and risk.
So kind of piggybacking off of the comment back here about mental health, right? It's interesting to me because I never thought about my husband's mental health too, going to having kids. And I never thought about that, but the finding here is very interesting because he does go through those things. But my question to you is, are there resources out there, or just things for the dads that they are aware of these, how to become a dad, but more so how to recognize these things, right? Like for us women, who see our OB, right? They talk to us about things to watch for, right? What they might look like, what postpartum depression might look like.
Mm-hmm.
So we know what those things, but the dads, what do they come in the future?
Right.
How do they become aware and recognize these things for themselves?
Yeah. So from a kind of like a systems kind of institutional level, right, I think something that for like kind of self-advocacy, when you're like seeing your OB or your pediatrician, right, this pediatrician is supposed to administer those assessment tools right after the OB period, right, after the 6-week checkup, is asking your provider, like, is there a resource for my partner? I like my husband, I noticed maybe he's having these symptoms, right? Because remember, the same outcome tools can be used for men as well. There's validity in that. The other piece too is, as you mentioned about like how to be a dad, is like, I love that you said that, because there is not enough education and awareness about like, until you become a dad, you don't know how to be a dad, right? And so that's why we push them to the side. Because we're like, just figure it out, okay, like we're all focused on the mom. And I'm not saying that we shouldn't focus on mothers at all. I'm saying we're going to have much healthier children when we focus on the dads too. And trust me, the moms will be grateful for this too, right? Is that fathers don't know how to be dads right off the bat. That's why my pet peeve is when people try to tell me how to parent, they don't got no kids, right? And so there needs to be dialogue and awareness and vulnerability that like, hey dad, it's okay, you don't know how to be dad because you've never done it. Do we expect people to know how to speak French if they never learned French? We wouldn't. Same concept applied. So when we can bring these ideas and very simple solutions, like, it doesn't need to require research, right? Why do we pay money to research on something so basic? Just talk about it. Like, it's okay, you don't know how to be a dad. Most people don't. A lot of parents don't know how to, mothers don't know how to be moms either. Okay? Like, let's just start with the very basic. Like, it's okay. These are things you can do. These are things and resources that you can go to. But when we set the expectation up here, and the awareness is down here, well, where do people go? they're gonna retract itself. Many times, or a lot of research has mentioned that or suggested that that men are at risk of postpartum depression and anxiety because their testosterone levels do decrease during pregnancy and then also the postpartum period. The other piece too that I thought was really interesting is that, do you know why? So when you hold a baby, you grab a baby, what side do you usually put on? Left side? Why do you think that is? Closer to the even for men. And when you pick up a baby, or most of us pick up a baby, and that's when the baby's kind of like whining and crying, whatever, but what's the first thing you do? Okay, or the butt, right?
You can't give it back to the mom.
Okay, yeah.
Yeah.
But many of us pat the butt, right? Like, right when you're holding a baby in your car, like you might pat the butt, or when the baby's sleeping, right, you're patting the back of the butt. Now, I'm gonna move us a different direction. Have you ever seen men on sports, and they're like, yeah, I got that, I don't know, touchdown, or they smack each other in the butt? I'm not saying go around hitting each other in the butts, okay? I'm just saying that butt smacking is actually very natural for men. Right, so you think about like, again, I'm not saying go up there and start smacking each other in the butts. I'm just saying, like, think about when we have a baby, right, a newborn, even if you give the baby to a man, right? Or the father, like right away, but he may not know how to parent or be a father, but he can pick it up and start petting it in the butt, right? That's a very natural instinct. So fatherhood does start right away, but as the child progresses, as fatherhood progresses, it does change because children and babies change. And it's okay for us to have these conversations and stop with the societal pressure that we are expected to exactly know what to do when we've never experienced it before. My example, if you wouldn't expect somebody to know how to speak French and you've never been taught French, it's the same thing. It would just be mind-blowing to us if you don't know how to speak French. Well, you're gonna talk to me, do, right? Right, like we wouldn't expect that, so we have to stop with the pressure on both parents, mom and dad.
Can I add something to it?
Yeah.
So, yeah, the concept of the father postpartum depression is very eye-opening for me as well. So, like, I was in the labor room with my wife, all 5 of my kids, and so I did have a sense of, like, I can see the pain that my wife is going through. I can see that she's having a hard time. And then there was always a thought of, like, what if something happens to her, right? And so I think, but then when I think about that for myself, I kind of feel like maybe some people look at me as being insensitive because why am I thinking about myself, even though I'm thinking about my wife? And I think that your question earlier about, like, why don't we talk about fathers and postpartum? And I feel like there's a perception that maybe, well, the wife is going through, the mom is going through so much physically, mentally, emotionally. Why should we care about what the father's doing? Because they're technically not doing anything, but being there and seeing all the things that. So I just want to make that comment.
Yeah. Think about. So you said, you know, I felt bad, right? Saying it because you're not the one going through the physical pain, right? What is your? How do you see yourself as her partner, as the mother? When you were there?
I wanted to try to make her as comfortable as I could. I wanted to support her as much as I could. I wanted to, like, I felt like if I could take the pain away, then that it should be about me instead.
So it was about her because you were experiencing that because you felt powerless.
Right.
And helpless.
Yeah.
Because you see your role as her protector. And that's not a kind you need to do it. So it was about her. Just not look at that way sometimes. Are there any more questions? Okay, I'm sorry. Can I answer?
Yes,
Oh, okay.
go ahead.
Yes.
So you touched on it very quickly. I was curious if you can elaborate on some of the research and academics on why literature says that it's better to keep children together with the mother or parents,
Yeah.
even if the home life can be very unstable, really affecting the child at school, can sometimes be dangerous.
Yeah. Because has shown over and over again that when a child, I'm talking about child welfare system now, right? Literature has shown over and over again that we can't assume that when a child is removed into foster care, that those foster care parents after them. And research has shown that. Okay. Yeah, when we remove a child from a parent, right, or the parent's home, right, because it's parents are using it or whatever, right, we're assuming that foster care parents love. Even though research shows that in most cases, despite the chaos in the home, biological parents love their kids more than anybody else can. So that's where it starts, right? But the other piece too about the, I think you said the CPS part.
I didn't mention that, but
Yeah, yeah.
I mean, that's, yeah.
Yeah, so like when there's like a using mom or something. Yep. So when we think about babies, right, and what are the very basic things that they need love, they need bonding, they need close protection, right? And they need comfort in what they're used to in the 9 months that they were in the womb. And that's the mom. Whether mom is healthy or not, that's what the baby knows. And so it's the attachment piece that is going to be critical to the child, right? So when we spend resources to remove children and babies, right, and put them in foster homes, assuming that, let's just assume in this case that foster parents or foster homes are loving and kind and have resources and time, right, for this baby, right? And most of the time, we know again that they don't. We're essentially removing the baby away from what they already know that's most comfortable. When I talk about maternal health, we know that whether a mom is struggling with addiction or not, right, her life choices doesn't negate the fact that she's human, right? Her addiction and her mental health disorder and the diseases that she's struggling with doesn't negate the fact that she can be a good mom. But when we remove babies from mothers, and many times babies are the protective factors, right? That is going to increase your chances of moms returning to use. So when we keep parents and especially mothers and babies together, you actually have lower rates of moms being in recovery. And I would love to, share the literature with you if that's interesting. Right here, information again. You know that.
Just a quick question. For single parenting,
Yeah.
you're missing a part, right? So how does that, what are some of the outcomes of the future of child support that due to some mental health issues or how do you supplement
Yeah. As single parents, yeah. So single parenting is interesting, and I would just also say that when I talk about trauma, I hope all of us don't walk out today thinking like, holy crap, I've done a lot of damage to my kids. Please don't walk away with that at all, right? It's for us to raise this awareness, and the way that trauma works is like, first we have to understand about these internal wounds that live inside of us that we need healing, and then for us to try to heal ourselves, because when we naturally heal ourselves, we heal our children. But back to your question about single parenting, right, is that being in a single parent household with a very loving father or mother or whatever it is better than living in a two-parent household that is completely chaotic with domestic violence. Like, let's just agree there, right? So that's one piece. The other piece too is going to be about your engagement and involvement with your child or those children and after school activities. So whether that is, having a big brother, big sister, I don't know where you're from, but here in the Fox Cities where I'm from, big brothers, big sisters is this huge thing, putting them in, swim or events after school, right? Boy Scouts, Girl Scouts, right? Activities that puts them in social groups, but you are there observing, and then also having a role in their extracurriculums is going to be a huge impact.
Going back to keeping mom and baby together, let's say first pregnancy mom is using and then continues to use in subsequent pregnancies. Would you still recommend to keep mom and baby together given that she has continued to with other children?
Yes, I heard like part of it while I was like walking over here, yeah.
So let's just say like keeping mom and baby together. So I just work in the birth center and the pregnancy, she's saying during pregnancy, let's say second, third, fourth pregnancy, she's continuing to use, and just given that pattern, would you still recommend to like, keep mom and baby together? I've just seen like babies come from unsafe places, or mom is using, and then we risk like continuing to keep them in that like unsafe place.
Yeah. So I think that's kind of a loaded question, right? And thinking about like where's mom and baby going after, right? Because you say you work in a birthing unit.
Mm-hmm.
Yeah. So like where are they going after? That's going to be a huge thing. Are they going to the streets? Are they going to their dealer's house or a safe place? So that's one piece. The other piece is like what kind of interventions are in the home, right? Or available to them, or has been offered to them. What has or has not been done. But if someone is continuing to use, especially not just like peers and moms, first thing that I always think about is like, why? Outside of the disease part, like why? Like, what are some of the wounds that like makes somebody feel and believe that drugs and addiction is the way to healing, right? Like, and what is that why there, knowing that that becomes a protective factor? Why and like, what can we do versus like removing? Yeah, because again, like, I think about the attachment between mom and baby, right? Especially like for that newborn child. And I also think about like the lack of resources for foster care, right? And like what happens to children in foster care. Like the longer that you keep somebody in foster care, the less likely they're actually going to be placed or adopted. And the longer that somebody is in foster care, their chances of becoming homeless in adulthood is higher. You think about the risk and benefits to all of our choices, right? Yeah, so yeah, to answer your question in a nutshell, yeah, I would keep them together. But I would assess, where are they going, what are their resources, what's been tried, what hasn't been tried, and what is the state of change, right, that mother is at. Yep. Thank you so much, guys. I love that everyone is so engaged with this conversation.